All right. Hey, beauties. Welcome back to my channel. If you're new here, welcome and thank you for tuning in. My name is Larice. I am your host and the founding owner of BeyondBody.com. But if you'd like to learn more about me, you could do so at IamLarice.com. So, in today's episode of Let's Ask the Surgeon, we are going to be talking about seromas. If seromas is a new topic for you, it definitely is pretty new for me too. So stay tuned while I bring Dr. Laverson out so he can discuss seromas. Hey, Dr. Laverson.
Hi, Louise. Good afternoon.
Thank you for tuning in. Thank you for your time. Thank you for being here with us today. So, today's topic is about seromas. So, the first question that I have for you is, what is a seroma?
Okay, okay, that's a good question. A seroma, seroma comes from the word serous. Okay, serous is like um, serous fluid is like straw-colored thin fluid. It's basically plasma. Okay, and plasma is the component of blood that's not cellular, meaning it doesn't have blood cells in it or platelets or white cells. It's just the fluid that the fluid that goes with the blood. Okay, so so a seroma is a fluid collection of this plasma that accumulates in a space after surgery. It's sort of, it's not a life threatening complication, but it's a very annoying complication because this fluid is just sitting there, and you know it's like it's just a bulge, and it's like a water bed, it's this fluid that really you want to get it out. and
Mm,
and and when you say what is a seroma, okay, strictly speaking, it's a fluid collection, but why? Why do you get that fluid collection? Well, think about this. Surgery is an injury to the body. And how does the body respond to injury? Like, for example, if you, I don't know, fall on your skateboard, get whacked, it's going to swell up. Okay, wherever you get hit, it's going to swell up. If you injure your ankle, it's going to swell up. So,
mhm,
so, so why does it swell? Well, because the body's response to injury is exudation of fluid. Okay, it's inflammation. That's the first stage of inflammation. The blood vessels, the capillaries increase their permeability, and this fluid exudes out, and the part that's injured becomes swollen. Okay,
mm.
so why after surgery does that fluid, instead of manifest itself as swelling, why does it manifest as a discrete collection of fluid? Well, the reason is because the surgery has created a space. Like, for example, if you have a tummy tuck, the skin is lifted up, it's repositioned, it's pulled down, it's tightened. But when the skin is lifted up from its underlying attachments, there's a space created. And then when the skin is sutured down, it doesn't heal instantly. There's a space there. And if your body's making fluid, it's going to accumulate in there, which is why we put drains in, because we know if we don't put drains, you're going to get fluid there. But usually, seroma happens after the drains are out, or if no drain is put in, or in a space where you didn't anticipate it, you didn't put a drain, and fluid does accumulate in the area where it hasn't healed yet. And so that's what a seroma is. I don't know if I explained it well enough,
You
but
did. You explained it, and you already look. This was the second question: what causes it to happen? But you already answered that. So
yeah,
yeah, you explained it quite well.
it's a response to surgery. It's just the fluid accumulating. First stage of healing,
So are you able to get a seroma if you didn't have surgery? So it's only it only happens in surgery instances. Like if you never had surgery, is a seroma an option? Like possible?
Yeah, it's possible. For example, if you have a shearing injury, okay, like sports injury, for example, um, I mean, say you fall off your skateboard and you scrape along the pavement, that's shearing. That's your skin can be sheared in that instant. When you fall on the pavement, your skin is on the pavement, but your body's still going. That'll create a space, a potential
Right.
space like surgery. Sometimes you get a seroma, and it can happen. I use a skateboarding as an example. It could happen after a bike accident or any other kind of accident where you've created a space by shearing of the skin on top of the underlying connective tissue and muscle. So the answer is yeah, it can happen even without surgery.
Okay. Um, are seromas a common thing?
They're very common. They are unfortunately very common, and that's why after many surgeries we routinely put a drain in because we almost expect it.
Mm,
When I do neck lift, tummy tuck, gynecomastia, meaning removing breast, during breast reconstruction, when breast is being removed for mastectomy, all those kind of surgeries, we routinely put a drain because we expect that exudative fluid to accumulate in the space unless we drain it.
okay. All
Yeah.
right. Next question is, what specific signs should a patient look for that would raise concerns of possibly having a seroma?
Okay. If after surgery you notice from day to day that area that you had the surgery is actually maybe getting a little more swollen or bigger. And I'm not talking about the first couple of days after surgery. Swelling's normal. But what if a week or 2 weeks after surgery, you've been back for a couple of appointments and all of a sudden it's getting bigger, not smaller. Normally as the swelling goes down, the area gets smaller. But if it's getting bigger, that's number one sign. Number two sign is the area where you had the surgery. If you press on the skin and it's like a waterbed, like you see that there's a what we call a fluid wave. It's like almost there's fluid underneath there.
Mm-hmm.
That's a seroma usually.
Okay. How does one get rid of a seroma?
Okay, so the most common treatment is uh, needle aspiration, meaning in the office, uh, the doctor will determine where exactly the seroma is, what are the limits of the seroma. It's usually right under the skin, and you can just basically numb that area of the skin, a little spot, and then pass a needle through and aspirate it. Okay, so that's the most common treatment. However, usually just needle aspiration won't completely get rid of it. It drains it,
Right.
but a lot of times there's still inflammation there. The fluid reaccumulates, and you have to do what's called serial aspiration.
Mm,
Serial, serial meaning more than once. You have to drain it maybe once a week or twice a week until it goes away and doesn't come back anymore. What
okay.
if it keeps coming back? What
That's
if,
the next question. Go ahead.
yeah, once gone, does it? Okay. Well, once it's gone, it usually doesn't come back in the same place. But sometimes serial aspiration is not enough. You have to put a drain in there. Replace the drain. And if the drain doesn't work or you can't get one in there, it's more surgery. You have to go in, take out the seroma cavity because the cavity's developed, and then reclose it over a new drain. Yeah, that can happen too, but that's not common. It's not common to have to operate on a seroma. Those are what we call refractory seromas, one that has not responded to repeated needle aspiration.
That's interesting that you said something about the capsule because one of the ladies in the groups, she had mentioned capsulation of the seroma, and I'm like, the only capsulation that I've ever heard of in regards to surgery is like the breast. So that was weird because I was like, does she know what she's talking about? Like, is that even a thing? So
Yeah.
when you say capsulation, like I know what that is, but so it forms over the fluid or
Well, well, that's a good question. Okay, the fluid's in that surgical space, but the body reacts to that by forming a little membrane. It's called a mesothelial membrane, and it does form a membrane around that fluid. And it's actually that's the cells in that membrane are secreting the seroma fluid. So she called it a capsule, and you could call it a capsule. It does tend to scar over time if you keep needle aspirating it, and it gets more firm and even hard. And yeah, it's a real capsule or a membrane, and you try if you have to reoperate on the seroma, you want to take that out.
okay. All right. So the next question is, are seromas avoidable? If so, what should one do in order to avoid getting one?
The most common avoidance strategy is to put a drain in, to drain all that fluid out until the skin is stuck down, till it's healed, it's solid, the glue is dry, the biologic glue that heals wounds is dry. And then how do we know when it's dry? When the drain output goes down to almost nothing. Okay, for a few days, there's almost no drainage. It means it's usually healed. It's not making any more fluid. You can pull the drain out. But that is the most common way to prevent a seroma. The other way to prevent a seroma is not too much movement. Okay, so I'll tell patients, for that week after I take the drain out, don't move too much in the area of surgery. If it's a tummy tuck, don't move your core too much. If it's the breast, don't move the arms too much. Don't go back to the gym yet, and try and keep it immobile. Because if you start moving and the glue is not completely dry, the biologic glue of wound healing is not complete, it might open up again. And then next thing you know,
Right.
you've got a seroma after the drain's been removed. So,
Okay.
so minimize motion in the surgical area and use a drain. And those are the two preventive strategies.
Would compression garments help in avoiding seromas as
You're
well?
absolutely right. That is actually the third one that I wasn't sure I should mention, but you're absolutely right. That positive pressure, the negative pressure of the drain sucking fluid out, can be complemented by positive, gentle pressure from a compression garment that helps immobilize the skin on the underlying tissue. So the
Okay.
answer is yes, Lorice. A compression garment may help, but the reason I didn't mention at the beginning is because a lot of time I used to tell patients when they had a seroma, wear the garment, wear the garment, and come back in 3 days or 5 days for me to aspirate it again. But I found, Larice, that the garment, whether they wore it or not, it seemed to come back anyway. So that's why I'm not sure how much the garment helps, but it may be a preventive strategy. Okay.
Okay.
It may not be good for treatment, but it may be good for prevention to help immobilize the part and keep the skin pressed down on the underlying tissue. Yes, it
Okay.
may prevent.
Okay. Awesome. The next question, can seromas get infected? If so, what are the signs of an infected seroma?
Yes, the answer is yes, they can absolutely get infected because the plasma inside them has protein. It's good food for bacteria. So,
Mm,
so you do not want, if it gets infected, it becomes what we call an abscess. And that serous fluid, the plasma, becomes pus. You do not want
mm,
that if you can avoid it. So the signs of an infected seroma are redness, more swelling, pain, and all of a sudden, when the doctor aspirates it, it's not clear anymore, straw colored. It's like cloudy, you know,
mm.
and the patient will know they'll have fever, sweats, chills, malaise, feel lousy. Um, yeah, they can get infected. That's why I try to make when I aspirate the seroma with a needle, I'm sticking a needle in there. I want that to be sterile. We prep the skin, we disinfect, we use sterile needles, sterile syringe. We do not want to inject anything in there unless it's sterile. That's another possible treatment. Inject a sclerosing,
Okay.
something to scar down the seroma. But yeah, they can get infected. It's not common, but you do not want to infect it. No.
Okay. And then the last question that I have relates to the previous question. Will antibiotics need to be taken for an infected seroma?
Okay, so generally, yes, the doctor who's managing the situation will prescribe antibiotics, but antibiotics are not definitive treatment. That
Okay.
the pus has to be drained. It has to be drained somehow. Either put a little drain in there, or you got to drain it. It's not just antibiotics usually.
Right.
Yeah,
Okay. Well, that I told you this was going to be a short one. That's all the questions that I have in regards to seromas for you.
Larice, that's so good. I appreciate you having
Yeah,
me on. I appreciate your audience, and anything else that I can do to help out, you let me know.
awesome. Thank you so much for your time, Dr. Laverson.
Thank you, Larice.
See you soon.
I am Larice.
Yes.
I
See you
am
soon,
Larice.
Dr.
Is it I
Laverson.
am Larice.com or is it at I am
Yep.
Larice? All
I
right,
am
good.
Larice.com.
All right, beyondbody.com and I am Larice.com. Thank you very much.
Thanks, Dr.
Bye bye.
Laverson.
All
I'll
right.
see you soon. Bye. All right, guys. So there you have it, Seromas. And like I said, Seromas is a pretty new topic for me. So, whether you've already had a seroma before, or if, you haven't even gotten surgery, but these are questions or concerns that you might have, I wanted to make sure that I created this video just to, raise awareness and just spark questions for you to ask for those that have not gotten surgery and you haven't done consultations, but you plan on consulting with physicians or surgeons. These are questions that you should be asking and finding out how they go about dealing with these situations. Are you going to be treated in case of a seroma? How do they, that particular doctor, deal with seromas? Are they going to prescribe medication? So these are good questions to ask inside of your consultations. So if you have any questions regarding seromas or any topics that you want to see talked about here on Let's Ask a Surgeon, make sure you leave them down in the comments section. I do go through and I read comments, and I'm interested in what you want to know, what you want to learn about. So just make sure you drop them in the comments. If this is something you like, make sure you subscribe to the channel, thumbs up. And if you have any friends, family members, coworkers, associates that you may know that this channel might benefit or be of interest, make sure you share this channel out. So until the next time, I'll see you guys later. Bye.